Shawna, have you ever had any like pain in your feet or stiffness?
Oh my goodness, Alli, who doesn't have foot pain?
I know. Thankfully, today we get some info and some answers and some help from our guest, who is a functional podiatrist and human movement specialist. Dr. Emily Splichal is here to tell us all about our feet and how to keep them healthy.
And before we dive in, let's give a shout out to our listener, Julianne Hawks. Thanks for listening. Now let's dive in.
Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
Welcome to the show, Dr. Emily Splichal. Thanks so much for coming on the Girls Talk Healthy Aging podcast today.
Of course. Thank you so much.
And we're going to start from the ground up today and talk about something that we utilize a lot, but we may not think about a lot, and that's our feet. So you are a podiatrist. So let's start there and tell us what you do and how you got into the whole field of studying feet.
So I am a podiatrist, but I am actually a functional podiatrist, which is an important distinction. So as a podiatrist, as a human movement specialist, I focus on the integration of the human foot, how our feet connect into our deep core, into our hip, how there are fascial lines. A huge part is how our diaphragm and the way that we breathe influences our feet. And then also as a functional podiatrist, I factor in things like sleep, stress, diet. So more the functional medicine meets functional movement, you could say. And then in addition to that, I'm the founder of Naboso, which is a sensory-based product line. And I am the founder of EBFA Global, which was actually just acquired by Naboso. But I am an educator, and I create a lot of certifications for professionals about feet.
Wow, that's a lot of footwork happening in your world. So tell us, how did you get into this? Take us back to a little bit of history on Dr. Emily and what drew you to the foot and beyond. Because we're not just going to talk about feet, because it's functional and there's a lot more. But yeah.
Yes, so the interconnection. So I was a competitive gymnast growing up, which is obviously a barefoot sport. Didn't think at that time that I was going to end up as a podiatrist, but that is an important part of the history. Have been in the fitness industry for over 20 years. So fitness became more of this, okay, I love movement, that side of it. And then as I was going through fitness, doing group exercise, being a long-standing athlete, I actually kept hurting myself. So I was teaching a lot, but getting hurt. I had every overuse injury, even in my early 20s, because I started training really heavy at 6 years old. So just think of what that would do to the body. So I knew that I had to, or I was drawn to go towards graduate school, something where I could still stay in movement, but potentially not have to use my body physically as a means. And I was living in New York City at the time, working as a personal trainer, group exercise. And my requirements were two things when I was looking at graduate school, medical school, etc. First, I had to be able to stay within fitness. So I was like, I have to train my clients. And then two is I had to be able to stay in New York City, which New York City is just a huge part of my soul. And that's a whole other podcast. But those two things, I had one choice: podiatry.
Wow. So why was podiatry the one choice?
It was literally the only school in the city that allowed me to stay in the city, which means I could still do fitness. This is so like not the way that I would guide children to make their decisions.
I love it though. It's so real. This is great. Yeah.
It's a very real. And then long story short of it is that I went in and was like, oh my God, I'm making the biggest mistake of my life. Feet are disgusting. But I was still training. And as I started learning things, I was connecting them to my clients. And then I started to see that it was a very limited profession, that it was looking at and teaching the foot like this, very narrowed and not connected. So I don't know if my brain was like, oh my gosh, there is so much potential in this profession that there is, if I could connect the dots to all this other, oh my gosh, there is powerful connections that I could make. I don't know if that's what it was, but as I was going through, I actually left podiatry training. I left residency, went back to school, and I got my master's in human movement, which is the way that I connected fitness, podiatry, and then the glue or the bridge is my master's in human movement, which then started to connect it all in my brain. And then I had to take the training upon myself to learn about fascia and breathing and pelvic floor and all of that. And then, yeah, it just evolved into what it is today. But yeah, very long story that it was by chance, really, or maybe it wasn't even chance and it was actually the world was just kind of guiding me there. And I didn't realize that till later.
Yeah. So tell us, I mean, yay, you got to stay in New York, which is where you are today, right? You're still in New York.
I'm actually in Arizona now.
Oh, really? So you did leave New York?
I did. I know.
Wow. So now you're in Arizona. So with feet, why are feet such an overlooked piece of this puzzle when we're starting from the ground up? And how does that, I mean, that getting to study feet, I know you studied human movement, which looks at everything, but then where do the feet tie in?
So what I want to say to precede my answer to that is for all of the listeners, I want them to think about the power of being able to move. And that is really based around walking. Most of us take the simplicity of human movement for granted, meaning the simplicity of our ability to walk across the room, which is, to me, a fascinating demonstration of the neuromuscular myofascial system that allows us to do that. And so that component, just thinking about walking, the only contact point between the body and the ground when we walk is our feet. So it's what dictates that story and that ability. And it's not just about a mechanical story, meaning, well, yes, our body is kind of like a building. And if our foundation is not stable, then the structure cannot be stable. That's part of the story. But the other part of the story that I think is even more powerful is that every time we take a step, our foot is striking the ground. We experience impact forces. Those impact forces are this energy that translates through the body to allow us to take the next step. And it's this dance of fascia and potential energy that's really happening. And your foot is the contact point that's leading into that with every step that you're taking. So that's why our feet are so important, is we have to be able to feel, connect, read, and adapt to every step that we're taking.
So really the feet are, I mean, we think about them as the foundation, but they really affect everything. I mean, everything starts there and moves up. So you talk about just reading some of your information about mobility and balance. What about balance and feet? Can we talk about how those two are related and how that's even related to the core and just the interconnectedness of our bodies?
Yeah. So balancing, you could look at balancing first as it relates to like mechanical, meaning that if you're standing on one foot and that foot is not stable, meaning you're collapsing into like a flat foot pronated position, well, now everything has kind of shifted, kind of like the Jenga blocks have shifted. And then you're trying to balance on one leg with these shifted Jenga blocks, right? Your body is kind of, well, if I shift this, then I have to shift this, then I have to shift this, right? And you just kind of keep shifting to maintain balance and gravity. So that's where if your foot can be rotated or strengthened or supported in a stacked position or a neutral position, then all those Jenga blocks kind of shift back into alignment. That's a first way you could look at it. Another way that our feet are really important to balance is our toes. And our toes are really this anchoring, gripping response that allows us to stand on one foot. And the foot, when we balance and stand on one leg, is very, very active. The toes are engaging, we're shifting, there's a subtle sway, and toe strength is a correlator to balance. So strengthening the toes is an important part of trying to improve balance. And I know that balance is super important for longevity, right? You have to be able to balance. You don't want to fall. You want to be able to still walk, etc. That has to involve strengthening the foot and your toe strength. It has to. Otherwise, I don't know if this makes sense, but it's like cooking a cake and not having the flour. I don't know. Like you don't have half the pieces in there that you need for the true solution or the strategy of how your body does it.
So what would you recommend if we advocate for strength training, but I've not really done much to strengthen my feet? And this is probably news to a lot of people. So what can we do because long-term, stronger feet are going to equate to better balance and, all the things that we need for healthy aging. So what would you recommend?
Yep, absolutely. So first one I would say is get connected to your feet. Is you have to have an awareness of your feet. You have kind of that mind-body connection, the perception. Do you even feel your feet? Do you know where your feet are in space? That's the first level that I work with when I work with patients and clients. Is we have to establish that first, because it's very difficult to add strength on top of something that you're not aware of, right? So that can be done by getting out of the shoes, getting out of the socks, learning to spread, splay, move, release, and just kind of articulate with your feet. Once we have that, I always then progress into teaching someone how to set their base, meaning all of us can control our foot. Some people, some progressed, rigid feet do not move. But most of the listeners, a far majority of the listeners, have flexible feet, which means we can rotate them. And even if you have a flat foot, you could still rotate into a position that is more stable and really spread your toes and connect into what would be stable. That's a second layer. Then it's starting to get into your toes. And I teach exercises like a forward lean where you just kind of sway forward. That activates the foot. There's an exercise called short foot, which is an activation of the toes. You can use things like toe spacers, will just kind of encourage the spreading and the splaying of the toes. Maybe getting into more minimal footwear. That's the start of it. Then there's a lot more.
And then let's talk about footwear, because as ladies, we like to put our whole look together. And many of us are really, we may not pick the best shoes as far as function and comfort when we're trying to look cute. And, women's shoes are a whole different ball game just in general. So can you speak to us about shoes? And I know you mentioned shoes that or more of like a barefoot style shoe, I think is kind of what you're referring to. But what about like high heels and the different types of tennis shoes with the thick bottoms and the different things that we're wearing? How do those things impact these fabulous feet?
Yes, and they do. So yes, footwear affects feet. So if you are thinking, let's think athletically first, or kind of that sneaker style of a shoe, is you have more of a minimal barefoot shoe that is not going to have cushion, support, stiffness, counters. You can twist it, you can fold it. That type of shoe has maximum freedom of movement that it is allowing, which means the person's foot has to be able to control that amount of movement. So that's an important distinction of how I guide people into footwear, right? Is minimal footwear, barefoot footwear, big picture is ideal, but you have to be able to control that level of movement, and all of the impact forces are coming into your foot when you walk or you run or you do movement. So you better understand how to control it. So that's an important part of it. Having said that, that's where most people we want to go. as you shift away from that minimal environment and you're more in stack, cushion, drop, stiffness, you can't twist the shoe. There's a counters, right? So that's, think like a New Balance would be an example of that, right? Or a Saucony, like a very classic shoe. That is taking away the natural freedom and movement and mobility of the human foot. Okay.
Mm-hmm.
Now, if you have a foot that is super flexible and ligament lax and mobile and you don't have the strength and the awareness, you might need something like that until you can
Right.
understand how to transition, right? So this is where footwear gets a little bit complicated.
So you have to make sure it fits your foot and where you're at, it sounds like.
Yes, where you're at, and then where do you want to go functionally, okay?
Mm-hmm.
Now, let's say you have a perfectly healthy foot that is perfectly flexible and perfectly strong, and then you go into a more structured, supportive, rigid shoe. You are inherently taking away that innate perfection of the foot, which
Mm-hmm.
means you can start to counter it, reverse it, right? So that's where the story of footwear can cause weakening of feet. Footwear can cause certain injuries. It causes a sensory disconnect. So that's how people can start to think about that. Okay. And I have a whole lecture that I do about guiding people through footwear and footwear decisions. What I will say, and then I will talk about high heels, is there's 3 things that I use when I guide people into athletic shoes, like a sneaker style, is what is your foot type? High arch, neutral, flat foot, pancake. What is your foot? 2, what is your injury history? Are you dealing with a chronic plantar fasciitis? Do you have a history of ankle sprains? Do you have a post tib? Do you have bunions? Just where are you at?
Mm-hmm.
And then 3, what is the activity or the demands in which you're going to put your foot under in those shoes? Meaning,
Mm-hmm.
are you going to stand on your feet for 10 hours as a nurse on the hospital floor? That's very different than these are the shoes I want to wear when I take my 1-hour Zumba class 2 times a week. I don't know, right? Like the recommendations are different based off of what the demand is. That is very, very important.
We're going to interrupt this interview for just a second because we've got something we want to make sure that you know. If you're struggling with your health, with your fitness, if you don't know where to start or you know what to do and you're not doing it, we're here for you.
And all you need to do to get our help is to reach out to Shawna and I at our email, sapodcast23@gmail.com. And we're happy to help and we will be in touch. Now back to the show.
What I'll say real quick about the high heels.
Before you go to high heels, let me give you I'll give you a foot to analyze. So I have I played basketball, so ankle sprains, probably more flat-footed. So, and I don't remember all of that, but those 2 things stuck out when you were talking. So what would be a recommendation for someone in that boat versus someone who maybe has a high arch, doesn't have a history of ankle sprains?
So I would say, what is the activity that we're using it for still?
Mm.
Right?
Yeah. So you're saying the shoe. So like, and I'm a trainer, so athletic, moving on your feet kind of person, maybe versus someone who has less activity,
Yes.
sitting at a desk.
Yes. So, which that is good because what that allows to now share, because I work with and I treat a lot of people in the fitness industry and like body workers and massage, right? Is those professions are on their feet a lot, but you're in the gym or you're in a physical space. So there's this perception of kind of stay minimal because you're in the space of just movement and fitness and all of that. However, it is very unnatural on the body to stand for long hours. So when you are training clients, I would say, could you go into more of a transitional shoe, maybe like an ultra or an on running, and had actually, so I want people to like heart skip a beat when I say this, but possibly a little arch support in there also. because it is very unnatural to stand on your feet that long. We are designed to move just like you're on like a walking treadmill. We are designed to move. We are not designed to sit, and we're not designed to stand. We are designed to move. So just take that for what that is, right? But then when you do your workout, get out of the arch support, get out of the ultra, and I want you in a totally barefoot shoe, or you're barefoot, right? So we're kind of playing that way. This would be very similar. Let's say, like I had said, the nurse. Maybe for the nurse it would be Hoka. And again, I know people's probably hearts are skipping a beat that I said the word Hoka because it's stacked and it's cushioned and it's rockered, right? But the Hoka is essentially saying, I understand that you are on concrete for 10 hours a day, 12 hours, right? Like you are, and you cannot think about your posture because you are trying to save lives, right? Something like that, right? So we are working with the reality of the situation of what we're in, right? But then I would say, hey, to the nurse, when you're not at work and it's the weekend, put on your Vivos, put on your Zeros, right? Something like that. When you work.
Yeah, or when you're going to the gym, because I have clients that come in with the super thick shoes all the time for training, and that's not the best shoe for a training shoe.
No, unless you have arthritis in the big toe,
Mm.
or something with the second MPJ, or like a nasty neuroma, something. Then I like Hoka for that. So it's like these 4-foot push-off pain presentations. Outside of that, if you have no pain in your foot and you're just using Hoka because they have really good ads and it's trendy to have them right now, I don't think Hoka should be in the gym. And if I get fired for saying that, I don't know who would fire me, but you know what I
mean? we won't fire you.
But you can't, because you cannot feel the ground. I have no idea how someone is lifting lower body when you are in those shoes, because you are so disconnected from your foot strength and from the ground that just, by golly, get them off.
Yeah, thank you for clarifying that, because I think that is something that people are just confused about. We see these shoes and they say running, and so people assume that means it's great for any kind of athletic, like, oh, I can wear these to the gym because it's a running shoe.
Yeah. I'm so glad you brought that up, and I don't mean to divert, but I feel like I have to say something. But yes, running. Okay, what is very, very unique about running, which is different than a workout, unless you're running on a treadmill in your workout, or you're doing like CrossFit, so you're running around the block or something like that,
right?
Is running is repetitive impact forces at 3 times your body weight in a very momentous, repetitive state. That is that movement. And that's where a stack like a Hoka, which came from ultra marathons and running, came in, because again, they were defined physiology. So there was a point that they wanted the cushion to take the impact to not overload the system. That is not the same as doing squats or even like step ups.
Yeah.
So yes, I am so glad you said that it's fascinating the way that we can connect things.
Well, we think running is activity, that's athletic, so that's the shoe. No matter what kind of athletic activity I'm doing, I think that's just a thing that is confusing for many people that are active or want to be active, or they're starting activity. They'll go out and buy running shoes. If they join a gym, maybe they buy a pair of running shoes to get, and that makes, I understand why people would think that is a good idea. So I'm glad that you're able to help us understand why that shoe is fit for running. But if you're not running in the gym, that might not be that. Well, that's not the shoe.
With that is running shoes are not stable. So there's a reason why, like cross trainers, right? What it is, it's typically a little bit heavier shoe. That's why people don't run in cross trainers. But a cross trainer shoe is going to be a little bit more stable. So when you squat and you step up and things like that, it's giving you that base.
Yeah.
Running is for a very quick foot contact and for forward progression.
Yeah.
So designed to get you going forward. Very different than squatting, right? So important distinctions.
Yeah. Yeah. And then we're going to talk about high heels. So I'm going to let you go to high heels next.
Yeah. So our high heels is, I truly believe in one, you only live once, and everything in moderation are some of my philosophies. So if a woman is going to wear high heels, I'm never going to shame her for doing that and say, oh my gosh, that is doing so much damage to the foot, because one, I'm wearing them also when I'm going out. So, don't want to be a hypocrite, but you want to understand, what do you do when you take the high heels off to reverse the unnatural stress that shoe placed on the body? That's where I would rather do it. Is let's just empower everyone so they understand to put on those toe spacers, release the bottom of the foot, maybe make sure you do some pelvic centering, because it can be a lot on the lower back, maybe stretch a little bit on the TFL or the muscles on the front of the hip, and kind of focus on that. And then when you wear the high heels, you really want to have high postural awareness. So you don't want to be passive in the heels. You got to stay active. So wearing heels is a lot of work. So I do ballroom. I do competitive Latin ballroom. So I am wearing heels. Mind you, they're 2.5 inches, so they're not like my other.
You're not doing the 4 or 5 inch heels.
That's for dinner. But so I'm wearing the 2.5, and yeah, it's really interesting that sometimes people are so surprised that I'm wearing the heels, but the heel is the requirement of the movement or the art or the athletic performance, whatever you want to think of it. And that's okay, right? So if people are doing it, so if people feel that they still love their shoes, that let's just think about, keep your feet strong when you're in it. Like, the shoe is never wearing me when I do ballroom. I am wearing the shoe. That's an important distinction, right? You are always wearing the stiletto. The stiletto is not wearing you. As soon as the stiletto starts wearing you, then you feel it. And that's where it does more harm.
And you mentioned the TFL, and I know what that is, but a lot of, when you wear heels, you need to maybe stretch TFL. Can you explain what and where that is to someone who may not know what you mean by that?
So TFL is tensor fascia lata, which is the upper outer hip. Oftentimes I will tell people, if you imagine you're holding a baby and you kind of pop your hip out, that muscle is what pops out. And that muscle, which is on the front of the pelvis, so it starts to tilt your pelvis forward, blends into your IT band, which is on the side of your lower leg, which is, of course, important when you're in stilettos, because you got a whole lot of outside, it's called your lateral line, but your outside line is more engaged than normal. So that's also why I like to give a little bit of a love to it, meaning you could use like a massage stick, foam roller, Theragun, something like that.
And where would they do that if they have like a massage or like some kind of handheld ball or massage toy? What would they do with that to help loosen that up when they're wearing their high heel after you take off your high heels?
Yeah. So I would do just a couple minutes, like let's say at the end of the day, because if you're doing it for dinner, now it's night. So who wants to do this like big mobility routine at night? But even if you do it the next morning, no one's gonna die. Like, we're good, right? So just next morning, slide on your toe spacers, release the bottom of the foot, maybe release the soleus, which is the lower calf. So it's just spend a few seconds. It's not minutes, just a little bit of time massaging the soleus. Spend a few seconds. So normally when I teach it, let's say here, you would do like 30 seconds on the soleus and then 30 seconds on the other one. So you just have this minute per body part that allows you to just kind of hit it quickly, give a little love to it, and then allow it to relax. Because the fascinating thing is they're all connected. So as you start to release the bottom of the foot, the soleus is relaxing, or the calf is, right? And then that actually The back of our leg connects to the front of our pelvis. So as you start to relax your calf, already your pelvis on the front is starting to relax. So that's where you don't have to be spending like 10 minutes foam rolling on your calf, 10 minutes foam rolling your quads. That's where you start to see drop off of people actually doing things, is that it just becomes like homework, like tedious.
Yeah, so that's fascinating, that the connection. And I think a lot of us don't realize how interconnected that working on your calf is going to loosen up the front of your pelvis. That's our body is so wild how it is all one side of the body can connect to the other, or one side can connect to the opposite side. I'm sure that gets more into some of the work that you like to do with the Naboso. Is that kind of along those lines?
Well, yeah. So at Naboso, we have different products that are sensory based, and sensory in itself can start to create a relaxation and a connection. What's interesting about this interconnection through fascial lines. So a fascial line, for the listeners, is connective tissue that is bringing one muscle and essentially connecting it to a neighboring muscle, right? Like your calf is connected to your hamstrings, right? Or the side of your lower leg, which happens to be called your perineals, is connected to your IT band. It's just this continuity of muscles into your body, right? So by targeting those interconnections, all of them, or a lot of them, cross into the bottom of the foot. If you release the bottom of the foot, to me, that is one of the biggest returns, or like a home run, right? If you're like, you can only pick one part of the body that's going to give you the biggest return as far as releasing of these different fascial lines. The bottom of the foot is going to be that, because they cross. They actually cross and then they connect into each other. So that's really powerful for a release. So at Naboso, the sensory products are essentially stimulating the bottom of the foot. They could release it with like our neuroball. Maybe it's our socks. So we have recovery socks that are going to act like a mini massage to the bottom of the foot as well. So you do get a big return from using the Naboso products, but targeting the bottom of the foot.
And what about toe? You mentioned a little bit about toe and arthritis or stiffness, and this is something as a trainer that I see so much, and I am dealing, have some of that going on already. And as we age as women, one of the common things that we see are these bunions or stiff toes or painful toes. Can you speak to like what is causing that, and where do we go if we're already, how do we prevent that? And then what if we're already there?
Yeah. So we think about the forefoot, which is where all of our toes are. This is where you could think of bunions also. Bunions, which is a deviation of the big toe, and there's typically a large bump on the inside of the foot by the big toe. That is associated with the two bones of the big toe joint. When you have a bunion, shifts and you are no longer centered on your cartilage. So it's like the joint slipped in a sense. So when you look at it on X-ray, you see that you're like, I am not anywhere near my cartilage, which therefore causes arthritis, because if you're not aligned on cartilage, you start to hit the joint weird, and it's called denuding. You denude the cartilage, which means you wear it down. You're wearing down the cartilage. So could you have a bunion with arthritis? And when you have arthritis, you have pain on range of motion, but even more so is you have limited motion because your body is creating spurs that now starts to lock down the joint. So you have a limited, it's called hallux limitus and then hallux rigidus. That's oftentimes with a bunion, not always with a bunion. I've had bunions that are super, super flexible, ginormous, and the patient has no pain. So one thing does not equal the other. Or you could have arthritis in the big toe, so you have no range of motion or limited range of motion, and you have no bunion. That's also a thing, which is going to lead to compensation or altered movement, primarily when you walk. So every time you take a step, your foot has to be able to push into this position. It's called a lever, your high heel position. So your high heel position is called a rigid lever. That position you cannot achieve if you have arthritis in your big toe. But that's the position that we need to achieve in order to take a step. Well, what are we going to do? You are going to somehow cheat the way that you walk, which means oftentimes you will shorten your stride. And when we shorten our steps, if you shorten your steps, you then no longer rotate your pelvis and your T-spine, and the whole thing starts to kind of lock up. That's a huge thing. Hammer toes real quick, and then I'll go into how you can modify it because it's all very similar. Hammer toes are a contracture of your digits, your toes. And when I work with people around hammer toes is I ask them, are they flexible or rigid? You would understand that by if you take your toe and you pull it, if you can pull it straight and then you let go and it zings back into the contracture, technically that's still flexible because it's pliable. If you have a contracture in your toe and you try to pull it straight and it's not budging, it is just stuck, contracted, that's considered rigid. That is not reversible unless you do surgery. So we have these distinctions. The toes, where I think about that and where I want the listeners to think about that, has to do with balance, which we mentioned earlier. Okay, so your toes are affecting balance and push off, those two phases of how we walk. So this is where you could look at toe spacers and shoes that modify or allow you to cheat the push off, which is Hoka, or it's a rocker, not just Hoka, but it's a rocker shoe. Dansko is another one, G-Defy, Orthofeet, or I used to actually tell my patients that you can go to certain orthotists, shoe cobblers, and they can add a rocker to any shoe. They'll just take the sole off of your shoe, put a carbon fiber rocker, and then put your shoe back on, or your sole back on. That's a way that you could do it as well. So that's how you can start to think about the forefoot.
So if if a listener such as myself already has arthritis in their big toe, left toe for me, aside from modifying shoes, I mean, I'm 62. I figure, hey, it's a rite of passage. Like, what can you know what I mean? It's just like, I don't want arthritis, obviously. I'm doing all that I can to avoid it, but I'm not going to limit mobility or stop moving. But I don't want to be bone on bone. Is the only thing that you can do is just modify your footwear, or is there anything to kind of stave off further, degeneration? What can we do?
Yeah, so there is something that's called a dancer's pad. And a dancer's pad, I don't think I have one in my region here, but a dancer's pad, the listeners can Google it, is something that would offload the first metatarsal head. And why that's beneficial is that every time we take a step, so we're extending our big toe, that first metatarsal head has to drop down. Okay, so by using a dancer's pad, you're essentially trying to force it down. If I force it down and I give you even another millimeter of dropping of that met head, do I give you another 5 degrees dorsiflexion? That's how you're kind of playing with it. So that's one thing that you can do. And there are what's called dancer's pads on Amazon. Get a 1/4-inch felt dancer's pad. Start by putting it on your foot and just try it, test it. If you like it, if it helps, if it feels less crunchy and jammy in your big toe, then add it to your insole. Put it on the underside of the insole. Or this is one reason where I may recommend orthotics, because you can build it into an orthotic. So that's something that you can do. Rocker-based shoes is another thing that you can do. The third thing that you can do, which doesn't sound like a lot of fun, but you are being very calculated of your flexions or your extensions of the big toe. Meaning, I may tell someone, maybe instead of jumping back in chaturanga when you take yoga, we just step back versus jumping, right? Because, or like a burpee, right? Burpee is barefoot. Every time you do that, you are jamming that big toe. So can we just be a little bit more calculated? Maybe instead of the 5-inch stiletto, you're doing a 3-inch, right? So it's making certain modifications to extend the longevity of the joint. That's how I think of that in my mind. And then of course there's surgery, but
yeah. Yeah, and I know I have clients as well that can't do a push-up position, can't do mountain climbers, and so it's just a matter of working around it. So I think it's important for listeners to remember that pain is telling your body something, and it can't be ignored for long periods of time without some sort of pushback. It's not going to get better. We have to listen to it.
And they are progressive conditions, like bunions are progressive. So if you have a bunion, every time you take a step, you are theoretically reinforcing the bunion. And not to sound pessimistic, but it's slowly progressing it. Now, it doesn't mean it's going to go from moderate to severe in like 6 months. It could be years, but that's where I try to teach people small, easy things that you do every day for your foot health. Like the toe spacers is one of the easiest because you just throw them on and they're great for decompressing or kind of creating a little bit of space around a big toe. So that could be something that you could do, Shawna. With bunions, great. You're trying to push pause. Hammer toes, same thing. But just what could we do that's just kind of adding a little positive to the stress of just natural human movement to that area?
And I think also having choosing shoes with a larger toe box instead of the pointy toed shoes.
Yep, that as well, right? So all of those become important small lifestyle changes that add up.
And I really like your point that you brought up earlier regarding high heels, in that sometimes there is a time and a place for a high heel, but then small movements, small things like stretching your calves out, massaging your feet after you get those shoes off, because we live in a world that, it's not all or nothing. I'm always of the mind all or something. So sure, wear the high heels, but then give yourself 5 minutes for a foot massage or calf massage at the end of the day or in the morning to kind of offset what maybe that shoe might have done to your foot.
Yeah. And I used to tell my patients in New York this, a little bit different outside of New York, but I would say commute to the office, not in the heels, and then put your heels on when you're in the office, right? So it's something like that also, right? So yeah, I love that. It's not all or nothing, all or something.
And another common, and I don't know how common, but this is another one I'm a little bit familiar with, the Morton's neuroma. Any kind of neuro issues, nerve issues with feet. Can you speak to that? And is there a shoe that's better for that, help for that? Is it kind of shoe spacers? Do those help that, or do we need to take a different approach?
So a neuroma is one. I'm going to first explain what a neuroma is, so everyone's very clear.
Perfect.
And then we typically see it and how it presents. So a neuroma is a ball of scarred nerve tissue. And how they form is that the nerves in the bottom of the feet are essentially kind of doing like that on the bottom. So they're crossing, and as they cross, kind of see that point that it's crossing, then you can kind of create that ball of nerve tissue. Also, all of these nerves, which are on the bottom of the foot, are moving in fascia. And we have parts of our fascia that they create compartments. And I'm sorry if this is confusing, but they're just groups of muscle that is surrounded by stiffer fascia. in our foot, when we go to push off, because this is important, because where neuromas get triggered is push off. So as you go to push off and take a step, what's happening to your foot, what's supposed to happen is that it stiffens and it retracts. Think almost like how you would lift the pelvic floor, right? You like, and when you do that, you pull that fascia back, and then the nerves are kind of like tightly in that. Okay. So if you do not stabilize the foot properly, you have a flat foot, you're overpronating, something with the shoe, whatever it is, right? And you go to push forward, the parts of the fascia are really sharp, and you're essentially irritating you're like not nicking the nerve, but you're irritating it, right? And when you irritate it, it starts to, now it's getting inflamed and it creates a response, which is creating like a scarring. This is important to understand because it's not just wide shoes. Like it's not just tight shoes that's causing the neuroma. Everything's way more complicated than Google wants you to think it is. But so it's about a lack of stability in the foot, which is causing these nerves that are crossing each other to get essentially irritated, compressed, and just continuously irritated, causing this. So when it comes to neuroma, a neuroma takes up space, and neuromas very classically sit between your metatarsal heads. Okay. Now, when you are in kind of by that metatarsal head, as you shift forward, what's happening is that your foot is supposed to widen. Your foot actually widens with every step that we take. It widens about 5 millimeters. If it does not widen, these met heads compress into each other, and then they can pinch the ball of nerve tissue. Okay, so part of how you prevent and navigate neuromas is you have to create a stable foot that retracts fascia back while your met heads are widening 5 millimeters. This is making sense. Okay, so let's say I have a patient who has a neuroma. Right now, I don't care the cause. I'm just trying to navigate this painful ball of nerve tissue. There's 2 reasons why it's irritating that patient. Like literally irritating that patient. One, it's inflamed. So there's a lot of acidity around it. So the pH around that neuroma has changed. Inflammation is fluid. So it takes up space, right? So is that it? That is just inflamed? Like if I have a cut here and I push the cut, it's going to hurt, right? Is that it? Or is the size of the neuroma big? Meaning that that's the problem, and I need to address the size. Because if I address the inflammation, this is where like a cortisone or a steroid injection, because you're trying to decrease the inflammation around this nerve bundle. If it's just the inflammation, that patient will respond perfect, right? And they'll be good. They're like, woo, I'm awesome, right? You could ice your foot. Could you do topical NSAIDs? Sure. It's kind of hard to get through the fat pad with topical things, which is why the foot's just a little bit unique in certain things. So that's it. Let's say, though, we do the injection, patient feels like a momentary relief, and then it comes right back. That's telling me it's more the size, which means I need to shrink the neuroma, right? Again, we can't get lost in the weeds of why did it happen in the first place, because I have to deal with this big old ball of scarred nerve tissue that is painful for the patient right now. So to shrink a neuroma, there are 2 things that you can do. One is alcohol injections. So you're injecting alcohol, and alcohol scleroses nerve tissue. That's why they say don't drink a lot, because it's not good for the brain, right? So it shrinks nerve tissue. Or you can do what's called like ablation. So you essentially like freeze it. You do radio frequency, something that's a little bit more a step aggressive, and you do that. Or you could surgically excise them. I very, very much do not go from one appointment to surgery because there's so many other things you can do in between. Okay. But we have that. Okay. Once you navigate the neuroma itself, then we can start to look at some of the more reasons of why it was irritated in the first place. Now, having said all of that, and I'm sorry if this was long-winded, but neuromas are a very, there's a lot of myths and misconceptions and frustration and forums about neuromas, especially stump neuromas. So if we go back to the beginning, let's say your neuroma is like a 2 out of 10 and you only feel it when you do lunges. And mind you, you would feel it as like a stab of pain. It'll be like a dagger. It'll create numbness into the toes. It's typically between the 3rd and the 4th metatarsal, right? It might feel like there's a wrinkle in your sock, something like that. That's how it presents. Let's say that's only 1 or 2 out of 10 when you're doing lunges with your trainer. And otherwise you're like, I don't really feel it, right? You could do what's called a metatarsal pad, which is all of the foot, and it's going to open your metatarsals. So it's going to take pressure off of the neuroma and toe spacers. I love toe spacers for neuromas. And we release the fascia in the bottom of the foot with a neural ball or something like that. Those would be my 3 steps. However, if it starts to increase or you feel it with every step or it's a little bit more, then we have this whole other side that I just spoke about. Strengthening the foot will not get rid of a neuroma. Oftentimes physical therapy, it's the one presentation that I'm like, I wouldn't send into physical therapy. They need an injection or they need to shrink it. We need to just kind of like deal with this ball of nerve tissue and then kind of look over here. That's kind of how I start to think about it. Rocker based shoes, sure, because you're just trying to avoid the flexion. Stop doing lunges until it's, so you're just thinking about what triggers it. How do you avoid the trigger? Are we trying to just like take pressure off the system and maybe it'll go quiescent? Maybe. Or do I have to look at inflammation or do I have to look at the size?
And I would love to ask about, like, I know as women, we oftentimes just deal with things. Something's hurting and we just deal with it, or we ignore it, or we live with it, we deal with it. And so I love that you're giving us things that we can do, like different kind of shoes to try, different paths. Is there, what about the consequences of that? If we're just ignoring it, is that going to just make that neuroma? Or whether it's a neuroma or whatever the issue is, what do we need to do and how soon do we need to do it?
Yeah, so great question on that. I would say, let's say in the case of the neuroma, I think that a lot of people, not just women, but maybe women also, especially if you're like mom and like busy and all the things, whatever you're doing, right? Is that we just know how to deal with a lot of stuff. We're not complainers. So it's not uncommon for me to have a patient who eventually comes in and they're like, yeah, I've had that neuroma pain, like a 3 out of 10 for like 5 years. And then they finally come in, right? So let's say if you have something and it's kind of irritating, things like this don't just go away on their own, right? So eventually it will talk loud enough that you finally listen to it. So that's where I like to then educate through platforms like this and say, hey, if it's not to the level or it's not a priority enough that you want to go in and do injections and stuff like that, at least can we be doing the met pad, releasing your feet and the toe spacers? So could I bring your 5 out of 10 to like a 3 out of 10 that you don't feel every day? To me, that's progression, that's successful, and that's improving your quality of life at this moment. So that's kind of how you could think of it also.
And Emily, you're telling us how people could actually work with you virtually. Can you tell us more about that?
Absolutely. So yeah, most of my patients are actual virtual. So I'm here in Arizona, as we mentioned, so I can see patients in person in my office. But again, most of my patients are virtual from all around the world. I can treat 99% of presentations. So it may seem a little bit new or surprising that from a podiatry human movement perspective that I can treat a majority virtual, but it works really, really well. And then and I spend an hour with every patient. So that's important as well. So I'm spending an hour with a patient virtually, going through a full movement assessment with them. And then every patient gets a personalized protocol based off of that consultation.
And how would they get in touch with you if they're interested in working with you, Dr. Emily?
Yeah, so all of my information is on my website, which is my name. So dremilysplichal.com. If that is too hard, it's thefunctionalfootdoc.com. I'm also very easy to find online. So just search Dr. Emily Barefoot, and that will kind of guide you. I'm the only podiatrist that treats in this kind of functional niche fascial way. So yeah, I'm not hard to find.
And we'll put the link in the show notes so y'all can find her website in the show notes. We'll have that there.
I love how passionate you are. You know, you can just hear it in your voice that you bring a lot of passion and knowledge to something that people probably don't think about a whole lot. Our feet. If you had a wish for our listeners today, what would it be?
So my wish would be that everyone starts today releasing their feet for even 2 minutes a day. And what I tell people to do is either get the Naboso Neuro ball, lacrosse ball, tennis ball, golf ball, whatever it is, but leave it in front of your bathroom sink so that every time you brush your teeth, morning, evening, you're doing something to your feet. Roll it, stand on the Neuro ball, you're doing something. So you're just starting to create the habit of healthy feet. Once we have that, then it's easier to start to kind of extend into all these other areas that we spoke about.
Well, and my wish would be that we do pay attention to our feet sooner rather than later and look for some of these quick and easy helps before we get to that like 10 out of 10 on the pain scale.
I love the idea of bringing the ball to the bathroom sink because I'm always one to say tie a habit to something that you already do. And most people, I hope, are brushing their teeth twice a day. And so that's such an easy thing. And the other thing would be to just do something simple like a toe spacer. Or, you know, like you said, I love the ball at the bathroom sink. I'm totally going to steal that one. That's my wish because that's what I'm going to do. I'm bringing my lacrosse ball to the bathroom sink. So thank you for that.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback.
If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience. Until next time, be healthy and be happy.